I'm Dr. David Hill, and today we're going to be talking about evening colic in infants. So let's back up and talk about colic. What is colic? Colic just has that old English sound to it, doesn't it? It's an old word. Now, you'll notice in medicine, when we understand things, we like to give them fancy new Latin names that refer to the cause of them. Colic is an old word because we don't know really what causes colic. We understand colic a little better than we did when the word was invented hundreds of years ago, but not as well as we would like to. We can describe colic very well, and we know a little bit about what the typical patterns are. Colic is crying that occurs for at least 3 hours a day, at least 3 days a week. Colicky crying looks terribly uncomfortable. Infants will often draw their knees up to their chest, scrunch up their belly muscles. They look like they must be in horrible abdominal pain. We don't know if they're in horrible abdominal pain. They may not be, but that's certainly what it looks like. The crying tends not to respond very well to a lot of things that you try. You might pick up your infant, rock her, you might try feeding her, you might bundle her, you might put her in her bouncy seat or drive her around the block. Sometimes these things work, often they don't, and that can be very frustrating for a parent. Now, one of the things that's typical of colicky crying is it tends to have a pattern. A lot of colicky infants will pick up their crying around the same time of day. Usually it's the early evening, about 7 to 9 p.m. for a lot of babies. That's why we're talking about evening colic in infants, because that's when it often happens. That doesn't mean that it has to happen at that time, just that that's pretty typical. So what can we do for colic? Well, we try dealing with things in the belly. We may try treating reflux, for example, with antacid medications or with formula changes. Unfortunately, our success rate with doing that tends to be very, very low, about 2 to 5% in the best studies. So if your baby's formula fed, we might rejigger the formula. If you're nursing, we might advise that you stop drinking cow's milk or stay away from soy protein. We might try ranitidine or Prevacid to treat gastric reflux, but we rarely get a lot of success. Now, there's a book written by Dr. Harvey Karp that is called The Happiest Baby on the Block. Dr. Karp's thesis is that you can bundle your baby, you can use calming techniques like allowing the baby to suck on your finger or a pacifier. You can sort of keep the baby over on his or her side or tummy for a little while on your lap, only while he or she is awake. Of course, you never want your baby to sleep on his or her tummy. That causes sudden infant death syndrome. You can shush loudly in the baby's ear, and you can jiggle the baby or sort of shake him very gently, not violently. And that may help colic. There's some reason to think that those methods are helpful. But sometimes nothing you do helps, and that's the time when you want to hand your baby to somebody else, or go ahead and let him or her cry in the crib and take care of yourself. Take a warm bath, get a cup of tea, listen to some soothing music. Make sure that that colic doesn't drive you crazy, because it absolutely will. It can even contribute to child abuse in severe cases. So make sure with evening colic that you're taking care of yourself, that you've done what's reasonable for your baby, and don't feel guilty if your baby continues to cry. Now, if your baby is greater than 3 months old and starting to have or continuing to have colicky symptoms, or if your baby is not yet 2 weeks of age and having colicky symptoms, those are a little more concerning. Those are unusual times to have colic, and you would want to talk to your doctor. Also, if your baby has a fever, is not feeding well, is not responding normally to stimuli, certainly those need to be addressed emergently if those symptoms are happening. Talking about evening colic, I'm Dr. David Hill.